The prevalence of kidney disease in our community today is actually very alarming, and it begs the question, what do we do? People often ask me, Dr. D, when the kidneys are damaged, can they be reversed? Or once the kidneys are damaged, the damage is permanent? For us to answer this big question, I believe that we must first understand the types of kidney disease. My name is Dr. D, and welcome back to the Renal Room. Sometimes people may develop one form of kidney disease or the other. Some might be lucky and they can regain their functions, while some might actually have to be on dialysis for a longer period, and some might even require a full renal transplant, also called kidney transplant, in the long run. Which actually brings us to the types of kidney disease. So there are two major types of kidney disease, which is number one, acute renal failure, or what we also know as acute kidney injury. What we mean by acute kidney injury is when there is a sudden loss or deterioration of kidney function, which is triggered by something happening in the body and causes a sudden shutdown of the kidneys in lay terms. It means that once the offending factor that caused the sudden knockdown of the kidneys is removed, there is a possibility that the kidneys might return back to the states that they were initially. Why do we say this? Because structurally, the kidneys do not actually have any damage going on. So something else that came to just cause that temporary shutdown, and once you treat the underlying cause, the kidneys can go back to the way they were. Now, the second type is chronic kidney disease, which is the one that most people are actually familiar with, because that's the one that lands you in dialysis, and that's the one that requires renal transplants in the long run. So chronic kidney disease can be defined as kidney damage or deterioration in kidney function, over a space of 3 months, when the glomerular filtration rate, will get to the meaning of these terms, is less than 60 ml per minute per meter square, CKD EPI. Big English, but just know that when the kidney functions are deteriorated below what we say 60%, you're already in a chronic kidney disease state, and this is a progressive worsening. It doesn't reverse itself, but it can worsen progressively. In our next video, we are going to be talking about the risk factors and causes of both acute kidney injury and also chronic kidney injuries. Even though a lot of these risk factors and causes might overlap, but we are going to be dissecting them in our next video. It's bye for now. See you again when we'll be discussing about the risk factors and causes of acute kidney injury and chronic kidney